Everyone, and now today we're going to talk about trematodes. So trematodes are commonly known as flukes, are a class of parasitic flatworms that belong to the phylum Platyhelminthes. So these organisms are characterized by their flattened leaf-like bodies and their complex life cycle, which involve different types of hosts. To study about the different stages of trematodes and their distinguishing features. So the first species is we have the Clonarchus sinensis.
Clonarchus sinensis, commonly known as Chinese liver fluke. Then, ang tawag sa infection na to is clonarchiasis. Ang ina-infect niya is bile ducts ng human and fish-eating mammals. Ang first stage natin is egg stage. Dito, siya ay tiny, oval, and light yellow na eggs na napapas in feces. Na yung eggs na yun is meron siyang developing larva na tinatawag natin na meracidium. Second stage is snail stage. Dito yung kapag yung snail is nakain niya yung egg, yung larvae is mag-hatch doon and go through different forms, which is meracidium, sporosis, rhadia, and cercaria. Yung cercaria na yun is mag-swim in water. So ang third stage natin is fish stage. Ito yung metacercariae. Dito yung cercaria is ma-infect niya yung freshwater fish and mag-form siya doon ng cyst doon sa flesh ng fish. Fourth stage is human infection. Dito is kapag tayo nakakain ng raw or undercooked infected fish na yung parasite is mapupunta sa ating small intestine. So, ang last stage natin is adult fluke stage. Dito, yung parasite is mag-mature sa bile ducts. Doon din siya makakain and bagalay ng eggs sa bile ducts natin. Then, doon, once na mag-lay siya ng eggs doon, yung cycle is mag-repeat lang.
Now, let's discuss about the unembryonated egg stage of Opistorchis species. The size is approximately 27 by 16. The color is yellowish brown and it passes in feces and the shape is oval. Next is embryonated egg stage. This develop inside a suitable freshwater snail and it is called the first intermediate host. Ang characteristics niya ay nag-contain siya ng fully developed meracidium larva and nag-hit siya inside the snail, releasing siya ng meracidium larva. So after na embryonated egg, next is the meracidium. Ang size niya ay microscopic, ang shape ay elongated with cilia, ang color niya ay transparent, at siya ay free-swimming ciliated larva with a short lifespan. Is after po ng meracidium, the sporosis, ang characteristics niya is, ang size niya is microscopic, ang shape niya ay sac-like, ang color niya ay transparent, tapos ang structure niya po ay nag-produce po siya ng asexually producing radices, which is the radiae. So, ang characteristic po ng radiae is ang size niya is microscopic, shape ay elongated, sac-like din, ang color is transparent, tapos structure niya po ay also nag-reproduce po ulit siya ng asexually producing, ang tawag naman po doon ay cercaria po ng radiae. Next naman po niya ay cercariae. So ang cercariae stage naman po dito po, ang size niya po ay microscopic, ang shape niya po ay elongated, may tail na po yan, and then ang color niya po is transparent, tapos siya din po ang nangyari po ito ay pre-swimming tailed, yung larva niya ay with may short metacercariae po siya kasi po from cercariae nagaling po sa snail as kapag nahanap niya na po yung fresh water na fish, mag-penetrate po siya dun sa muscles nito, tapos mag-insist po siya at magiging metacercariae. Tapos ito na po yung pinaka nakaka-infect kapag kinain po natin yung fish na nagka-contain ng metacercariae. Kapag kinain po natin ito ng hilaw, yun na po yung nakaka-infect. So, the last one is the adult stage. The size is 5 to 10 millimeter long and 0.8 to 1.9 millimeter wide. Shape is leaf-like, tapos ang color niya po is transparent. Also, yung adult stage din po is a flat leaf-shaped fluke with a may ventral sucker po siya sa acetabolum, tapos may smaller than the oral sucker po siya. And then, nagde-develop po siya, nakatouch po kasi siya sa mucosa. Kapag natouch siya dito sa mucosa, dito po sa bile ducts, at may egg po siya na inalay after 3 to 2 weeks.
So, mag-proceed na tayo sa Schistosoma japonicum. Ang Schistosoma japonicum ay may 6 stages. Yung first stage na is yung egg. Ang size ng egg is 70 to 100 nanometer in length and 50 to 70 nanometer in width naman. Yung color niya is transparent to light yellow. Wala silang prominent spine pero meron silang small lateral nerve. Yung shell nila is thin and smooth. Tapos, ito yung nag-hatch into meracidia. So, yung second stage naman is meracidium. Ang size ng meracidium is 100 to 200 nanometer in length. Tapos, yung shape naman niya is small, ciliated, and actively swim. Meron silang eye spot from detecting light. Tapos, ang na-seek out nila is yung Oncomillania snail. Pag hindi sila nakahanap ng host within a few hours ay mamamatay agad sila. Tapos yung third stage is sporosis. Yung sporosis, ang shape naman niya is elongated and sac-like. Nagagrowth ito by absorbing nutrients sa mga snail at nag-undergo ito ng multiplication. Mas marami sa lumami. Yung stage ito nagalaslaan siya ng 4 to 6 weeks. Yung panglimang stage is yung cercaria. Next stage is yung cercaria. Ang shape nito ay parang tadpole. Tapos, actively swim din ito at ito ay nag-penetrate sa human skin. So, pag hindi sila nakahanap ng human host within 24 to 48 hours ay mamamatay din sila. So, yung next ay yung schistosomulae. Ang shape nito ay small, elongated, and may nakakover ito ng thick protective membrane. Ito ay nag-migrate sa blood vessel, tapos nag-pass through the lungs and liver. Tapos ito yung nag-mature into adult worm. Tapos next and last is yung adult. Dito is ang size niya is kapag male ay nag-measure ito ng 8 to 15 mm, and pag female naman ang measurement nito is 9 to 20 mm. Tapos ang shape na ay slightly large ito and more rounded. Tapos yung worm na ito ay nag-migrate siya sa small intestine blood vessel. Tapos yung female ay nag-lay siya ng egg na 1,000 to 500 to 3,000 eggs per day.
So now, let's proceed about Cystosoma mansoni. So the first stage po is the egg, which is the size is 140 to 175 in length and 45 to 70 in wide. Tapos ang shape niya po is oval with lateral spine. The color niya po is transparent to light yellow. Siya po ay smooth but slightly thick po yung shell niya. Tapos yung eggs po niya are excreted dun po sa feces and nag-hatch po siya upon contact with fresh water na po. After the egg stage, next is the meracidium stage, which is the size is 100 to 200 length. Then the shape niya po is oval to elongated. The color is transparent with a bluish tint na po siya. And then, nako-covered po siya ng tiny cilia which allow them to move actively in water. Yun po yung nag-allow sa kanila na mag-move sa water. Tapos, they have eye spots which help them detect light and navigate toward their snail host. After the meracidium stage, the next po is the sporosis stage, which is the size are 200 to 40. Tapos, ang shape niya po is thin, tapos elongated, may sac-like. During this stage naman po, nangyayari po yung parasitics, nag-undergo po siya ng asexual reproduction, tapos nag-create po siya ng multiple daughter sporocytes which later develop into cercarina po. So, after the sporosis stage, next stage is the cercari stage. So, ang shape niya po is tadpole-like in shape. They actively penetrate human skin. Sila po yung nag-penetrate sa human skin using ng enzyme from their penetration gland. Then, the cercari must find a human host within 24 to 48 hours lang po. And after nun, kung hindi naman po is mamamatay po sila. After cercari, the next stage is the cystomole. Ito po ay small, elongated, and covered in a thick membrane to protect itself from the host immune system. So, yung thick membrane niya po ay yun po yung nag-protect doon sa host, sa immune system po ng host. And then, ito po ay cystosomulum, nag-migrate po ito through the blood vessel dito po sa liver where it continue develop na po. And the last stage is the adult, which is size is in male 6 to 12 mm, tapos in female 7 to 17 mm. Yung shape niya po is slender and curved, tapos yung male po nito meron siyang gynecoporal canal. Ito yung growth that holds the female worm during mating. Tapos yung adult worm niya po, ito yung nag-migrate to the large intestine blood vessels where the females lay. Nag-lay po siya ng 300 to 400 eggs per day, which later excreted in sa feces na po.
Now let's move on to Cystosoma hematobium. We have 6 stages of Cystosoma hematobium. First stage is egg stage. Yung size is 110 to 170 nanometer in length and 40 to 70 nanometer in width. Yung shape nito is oval shape and elongated, as you can see in the picture. Itong eggs ito is meron siyang terminal spine at one end. Excreted in urine. Upon contact with fresh water, they hatch into meracidia. So, ang unique characteristics ng Cystosoma hematobium is nag-excrete siya sa urine, while yung Cystosoma japonicum and Cystosoma mansoni is na-excrete through feces. Next stage is Miracesia stage. Yung color nito ay transparent with a bluish tint. So as you can see in the picture is napapalibutan siya ng cilia. Itong cilia na to is ginagamit nila to move para makasearch sila ng kanilang intermediate host, which is yung Bolino snails. And nakakapag-survive lang sila only a few hours in water if they do not find a snail host. Next stage is sporosis. The porosis absorbs nutrients from the snail and undergoes asexual reproduction, producing daughter sporosis. After about 4 to 6 weeks, they develop into cercariae and leave the snail. So, dito sa stage na to is, dito nagde-develop yung Schistosoma hematobium dito sa intermediate host nila, which is yung snail. Then, after nila mag-develop is aalis na sila sa snail, at yung next stage is yung cercariae. Yung shape niya is tadpole-like. They actively seek a human host, penetrate the skin using enzymes. So, after nilang makaalis sa intermediate host nila is maghanap naman sila ng human host. And after nilang makapasok sa human, yung tails nila is nagpo-fall off and they develop into schistosomidae. Next stage is schistosomidae, small and elongated. Meron siyang thick protective membrane. It migrates through the blood vessels to the liver before maturing into an adult. Next stage is yung adult. Yung size niya is, for males, we have measure 10 to 15 millimeter, and while females measure 10 to 25 millimeter. Yung adult worms ay more likely na elongated. The worms migrate to blood vessels of the bladder, where the females lay 20 to 200 eggs per day, which are later excreted in urine. So now let's talk about Fasciola species. So we have Fasciolasis hepatica and Fasciolasis gigantica. So first, let's talk about Fasciolasis hepatica. So yung Fasciolasis hepatica is commonly known as sheep liver fluke. Found worldwide naman tong Fasciolasis hepatica, especially sa temperate region like North America and Europe. So we have 8 stages of Fasciolasis hepatica. So first stage is we have an embryonated egg passed in the feces of infected animals or humans into water. So sa water, once na nakapunan sila sa water is magiging embryonate egg na sila within 10 to 15 days. So next stage is embryonated egg. So same lang naman siya sa an embryonated egg. Ito naman ay nag-develop na siya sa fresh water over 9 to 15 days. Next stage is Miracesia. So as you can see in the picture is yung body niya is covered with cilia. So itong cilia na to is ginagamit nila for movement and para makahanap sila ng kanilang intermediate host, which is yung intermediate host nila is yung Galbatran catula snail. If hindi sila nakahanap ng kanilang host within 24 hours is pwede silang mamatay. Once na maging successful na sila na makahanap ng kanilang host is next stage naman is sporosis. So sa sporosis naman is a sac that forms inside the snail containing germ cells. Next stage is radiae. So, itong radiae naman na to is nagka-possess naman sila ng rudimentary digestive system. Thicker naman siya kesa sa sporocyst. So, ginagamit na nila yung snail para dun sila mag-develop and kinakain nila yung tissues ng snail. Next stage naman is cercariae. So, sa cercariae, as you can see in the picture, is para siyang tadpole with a long tail. Ito naman is ready na silang umalis sa intermediate host nila and maghanap naman na sila ng aquatic plants para doon naman sila mag-transform as metacercariae by forming cysts. So, next stage is metacercariae. So, as you can see in the picture is yung shape niya is round with a thick walled cysts. Ito naman is may kita mo siya sa mga aquatic plants like watercress. So, ito sa stage 2 is pwede silang maka-infect ng animals or humans kapag ingest. And once na ingest nila is kaya nilang nakasurvive sa stomach acids and exist in the duodenum. Next stage is yung adult fluke. So sa adult fluke naman is dito na sila maglilay ng eggs nila which are passed out in feces restarting the life cycle. So, next is we have Fasciolasis gigantica. So, itong Fasciolasis gigantica naman is commonly known as giant liver fluke. So, ito naman is may kita naman siya sa mga tropical region like Africa and Asia. So, ito naman sa Fasciolasis gigantica, we have 8 stages of Fasciolasis gigantica. So, first stage is an embryonated egg. Ito din is released in feces and enters fresh water. Once na naka-enter na sila ng fresh water is next stage nun is magiging embryonated egg na sila. So, ito naman is yung shape niya is oval with an operculum at one end. Next stage is miracidia. So, ito din is ginagamit nila yung kanilang cilia, since covered nga siya ng cilia, is maghanap sila ng kanilang intermediate host, which is yung intermediate host naman nila is radix species snail. If hindi nila pag hindi sila nakita ng kanilang intermediate host within 24 hours is pwede silang mamatay. Next stage is sporosis. Once na naging successful sila na makapasok sa kanilang host, is dito na sila magde-develop. So, yung first nito is yung sporocyst. So, itong sporocyst na to, and meron siyang thin, transparent membrane, and undergoes asexual reproduction, producing multiple radiae. So, next step is radiae. So radiae naman is nagproduce naman siya ng cercariae inside the snail. And meron din siyang rudimentary digestive system. Next stage is cercariae. So, cercariae is tadpole-like din siya with a long tail. And ito naman is ready na silang umalis sa kanilang intermediate host once na kumakain na din kasi sila ng snail tissues. Then, once na nakaalis na sila sa snail host sila, is maghanap na rin sila ng aquatic plants. So, next stage naman nila is metacercariae. So, ito naman sa metacercariae, yung shape niya is round with a thick walled cyst. At ito naman is remain dormant lang siya until ma-ingest siya ng kanilang definitive host, which is yung animals or yung humans. Infects animals like cattle, buffalo, humans when ingested. So, next stage is we have adult fluke. So, ito namang adult fluke, ito, yung shape niya is leaf-shaped but more elongated. Ito rin is same process lang din sa Fasciolasis hepatica. Mag-release din siya ng thousands of eggs per day which are passed in feces, restarting the life cycle.
Let's proceed to Fasciolopsis boschi. Fasciolopsis boschi have 8 stage. First is yung unembryonated egg. Ang size niya is approximately 130 to 140 nanometer long and 80 to 85 nanometer width. Shape niya is oval, tapos ito ay hindi pa fully developed na meracidium. Next is yung embryonated egg. Same yung size niya sa unembryonated, tapos same din yung shape which is oval, tapos ito na yung mature na meracidium larva. Next is yung miracidia. Approximately 150 nanometer long siya. Ang shape niya is elongated siya, cylindrical. Tapos yung mobility niya is nagamit siya ng cilia for locomotor. Next is yung snail stage, which is may tatlo. Yung sporosis, ceridia, and cercaria. First is yung sporosis. Ito ay highly variable, ranging from microscopic to several millimeter in length. Tapos ang shape niya is sac-like. Next is yung radia. Tapos typically is 0.2 to 2 mm in length, tapos yung shape niya is elongated siya. Next stage is yung cercaria. Nasa snail stage pa nito, around 20 to 13 nanometer length to, tapos ang shape naman nito is tadpole, parang paba. Tapos next stage is yung free swimming cercaria. Ang shape niya is similar lang sa snail stage na cercaria, tapos large siya, mas malaki siya sa meracidium, tapos mobility niya is nagamit niya yung tail niya para mag-move siya sa water. Tapos next is yung metacardia. Size nito is smaller than cercaria, tapos oval yung shape niya, tapos ang mobility nito ay not motile and dormant stage. Next is yung existing metacardia and duodenum. Ang size nito is similar sa metacardia but without cyst. Tapos, ang mobility nito is non-motile and become motile as they develop. Tapos, next and last is yung adult. Ang size nito is large siya, approximately 75 mm long and 20 mm width. Tapos, ang shape nito is ovoid or epithecal, oral and vertical sucker sila. Nagasak sila yung fully developed ng ngipin nila. Tapos, fully developed na rin yung reproductive organ dito. Ng ovary, testes, tapos uterus, kasi ito na yung nag-ano ng maraming egg.
So let's talk about the Paragonymous Westermann. First stage is the anabariotic eggs. Its stage is relatively large, its shape is oval or ellipsoidal, then its upper column is present, a lid structure at one end, and its color is typically brownish-yellow. Its shell is thick, then its contents initially contain a single immature zygote with no fully developed mericardium yet. Next stage is the embryonic eggs. Its size is similar to anabariotic eggs, then its shape is oval or ellipsoidal, upper column is present, then it contains a fully developed mericardium larva visible as coiled structure within the egg. Moving on to the next stage, Myricidia, its size is relatively small, shape elongated and cylindrical, motility active free swimming using cilia or locomotion, and it possesses an apical papilla and penetration glands for entering the snail host. Now let's move to the snail stages. First is the sporcis. It is sac-like structure, relatively simple in morphology. Next is radiae, more complex than sporcis, often containing developing cercarinae. Lastly is the cercarinae, possesses a tail, caudal appendage for locomotion, an oral sucker, and penetration glands. They are infective larval stage released from the snail. Now let's move on to the cercarinae. Its size is larger than Myricidia, then its shape is similar to snail stage cercarinae but actively penetrating the crustacean host. Motility is it is active using their tails for or movement, then it penetrates. Moving on to the stage of metacercerae. Its size is smaller than cercerae, but but the shape is oval or rounded, enclosed within a cyst wall within the crustacean tissue. It is a non-motile and dormant stage, and it is found in cysts in crustacean tissue ready for ingestion by the definite host. Moving on to the second to the last stage, existing Metacercerae in Duodenium. Its size is similar to Metacercerae but without a cyst. Its shape is oval or rounded. Its motility is initially non-motile, then become motile as they develop. It begins migration to the lungs. Moving on to the last stage is its size is relatively large, then its shape is ovoid or elliptical. Then it resides in the cystic cavities in the lungs. Then it well developed in reproductive organ. It is well developed in producing numerous eggs.
We will going to talk about the morphological characteristic of the three species of the schistosoma. So first is the tegument papillae. So yung tegument, it is the outer surface of the parasite, and yung papillae are small hair-like projections on the tegument that may play a role in sensory functions and attachment. Next is we have the number of testes. So testes are the main reproductive organs which is responsible for producing sperm. So the number of lobe testes varies among species, influencing reproductive capacity. As you can see sa table, iba-iba sila ng lobes per species. Next is we have the position of the ovary. So the ovary is the female reproductive organ na responsible for producing eggs. Yung position niya is either anterior, mid-body, or posterior, and it varies among species affecting egg production and development. Then we have the uterus. The uterus is the part of the reproductive system where eggs stored are before being released. So a short uterus contains fewer eggs while a long uterus holds many eggs, which affects the parasite's reproductive success. Next is we have the vitellaria. Vitellaria is a structure that produces nutrients and materials needed for egg development. So it extends from the mid-body to the posterior in all three species, aiding in egg formation. Next is yung egg morphology ng mga species. So iba-iba sila. Dun sa Hematobium, as you can see, is meron siyang terminal spine, a spine at the end of the egg, oval in shape. Then yung next is we have the Manzoni. Yung Manzoni naman is oval with lateral spine, a spine on the side of the egg. Next is yung Japonicum. Yung Japonicum is a round egg with a small lateral spine. So yung mga differences nila sa eggs is nakaka-help para ma-identify yung mga species under the microscope. Next is we have the habitat in the definitive host. So the definitive host is where the parasite reaches maturity and reproduces. So each species prefers different blood vessels in the human body. So sa Hematobium is sa urinary bladder veins, yung Manzoni is sa large intestine, and yung Schistosoma japonicum naman ay sa small intestine veins. Next is the intermediate host. Yung intermediate host, it is where the parasite undergoes larva development before infecting humans. So different species of snails act as an intermediate host. So sa Hematobium is Bolini snails, sa Manzoni naman is Biompalaria snails, and sa Japonicum is we have Oncomellaria snails. Next is infective stage. The cercarrier is the free-swimming larval stage of all species of Schistosoma. So yung cercarrier is yun yung siya ay nag-penetrate sa human skin when a person comes into close contact with contaminated fresh water. So once inside the body, they develop into adult worms and begin the infection cycle. So good day everyone, now I will be presenting a case study on Fasciolopsis buschii, the largest intestinal fluke affecting humans. The title of our case study is Surgical Intervention for Fasciolopsis buschii Infection. So this case report describes a rare Fasciolopsis buschii infection in a 15-year-old girl from Gaochu, China, who experienced recurrent abdominal pain for 10 years. So dito na misdiagnosed as a choledochal cyst yung sakit ng patients instead of Fasciolopsis buschii infection since may same signs and symptoms. So the patient underwent exploratory laparotomy but post-operative hepatology confirmed biliary obstruction due to Fasciolopsis buschii. So let's move. Fasciolopsis buschii, a zoonotic trematode of the Fasciolidae family, is the largest intestinal fluke affecting humans. It is primarily found in Southeast Asia, including China and India, with pigs acting as a reservoir host. So reservoir host meaning it is an animal or organism na nag-harbor ng pathogen or parasite without being significantly affected by it. So, humans become infected by consuming raw or improperly cooked aquatic plants such as water chestnut or bamboo contaminated with infection metacer carrier. Yung metacer carrier, ayun yung larva stage ng trematode that affect the definitive host such as human or animals. Now let's look at our patient's background. We have a 15-year-old girl, female from Gaochu province, China, who has been experiencing recurrent abdominal pain for the past 10 years, with worsening symptoms in the last 4 days. Her case was initially diagnosed as cholangitis due to intrahepatic stones, but despite treatment, there was no significant improvement. Let's discuss the clinical presentation of this case. The causative agent here is the Fasciolopsis buschii, a parasitic trematode. Infection occurs when a person consumes contaminated freshwater plants such as water chestnut, lotus roots, or bamboo shoots, which contain encysted metacer carrier. Once inside the body, the parasitic causes various symptoms including upper middle abdominal pain, malnutrition, anemia, and eosinophilia, an indicator of parasitic infection. In severe cases, it can also lead to cholangitis or bile duct infection as seen in our patient. Move on to the diagnostic assessment of the patient, first based on the physical examination. The patient presents with mild anemia, malnutrition, and light tenderness in the upper middle abdominal region. For the laboratory findings, blood test revealed hemoglobin level of 116 gram per liter indicating mild anemia, neutrophils at 71.1% and eosinophils at 8.0%, which suggests a possible parasitic infection. So, alkaline phosphate at 152 unit per liter indicating mild liver dysfunction, and the bilirubin levels remain normal. Continuing with the diagnostic assessment, we have additional findings from stool analysis. It showed no parasitic eggs detected before or after surgery. For imaging, including ultrasonography and MRSP, as you can see in the image below, is there was a dilated common bile duct and a right intrahepatic stone was also identified. Lastly, the gastroduodenoscopy findings revealed superficial gastrosinusitis. Moving on to the exploratory laparotomy findings, the procedure revealed slight gallbladder edema and a thickened common bile duct. No tumors or other abnormalities were found, and a flat motile parasite measuring 1.6 by 1.0 by 0.1 cm was removed from the common bile duct, and green pus was observed in the hepatic duct and common bile duct junction. So for histology, the parasite was identified as Fasciolopsis buschii. So these findings confirm the presence of a parasitic infection affecting the biliary system. So as you can see in the next image or the next slide it is a Fasciolopsis buschii under the microscope, which confirm its infection. Let's talk about how this case was managed successfully. For the pre-surgical treatment, the patient received antibiotics, analgesics, and liver protective drugs. In surgical intervention, a common bile duct exploration was performed, preserving the gallbladder. So the parasite, Fasciolopsis buschii, was removed and a T-tube drain was placed for bile drainage. For the post-surgical management, antibiotics and liver protective drugs continued with oral praziquantel given on post-operative day 6. So for the outcome, the patient recovered without any severe complications, and the T-tube drain was removed after 4 weeks. So for the follow-up, the stool test or stool analysis were still negative for the Fasciolopsis buschii eggs, confirming a successful treatment. So diagnosing Fasciolopsis buschii infection can be challenging, especially when they cause biliary obstruction, mimicking other conditions like choledochal cyst. Standard tests may not always detect the parasite, so understanding a patient's epidemiological history such as consuming raw water chestnuts is essential. While praziquantel is the primary treatment, delayed diagnosis can lead to unnecessary surgeries. This highlights the importance of awareness among doctors or clinicians, particularly in endemic areas. Prevention efforts should focus on public health education, sanitation, and safe food practices to minimize the transmission risk. To conclude, Fasciolopsis busca infections are rare but can be severe when they affect critical areas like the biliary tract. Diagnosis depends on patient's history, eosinophilia, and stool exams, but a typical case poses challenges. While praziquantel remains the standard treatment, severe or unclear case may require surgery when intervention is needed. Minimally invasive procedures like endoscopy or laparoscopy should be prioritized to reduce surgical risk. And that's the end of our report. Thank you for listening.